Hi, everyone. Welcome to this presentation on the impacts of the COVID-19 pandemic in Northern Michigan, hosted by the League of Women Voters of Northern Lower Michigan. I'm Robin Jordan, local league president. We're pleased to offer a panel of experts presenting on COVID-19, a topic that holds some degree of interest to most people around the world. This presentation is being recorded and will be made available to you on our YouTube channel. The link should be on our webpage in a few days. For those of you unfamiliar with the League of Women Voters, we are a nonpartisan political organization that encourages informed and active participation in government. We work to increase understanding of major public policy issues and influence public policy through education and advocacy. The League empowers voters and defends democracy. We do not support any political party or any political candidate. Diversity, equity, and inclusion are central to the League's success in engaging all individuals, households, communities, and policymakers in creating a more perfect democracy. Anyone over the age of 16 is welcome to join the League, and membership for students is free. We have vital work to do. Information about joining the League is found on our website. For our members present this evening, please note that we're going to have a member meeting directly after this webinar. Please check your email for the link to that meeting. Our moderator this evening is Eileen Mikas, co-chair of our Healthcare Committee. She will be introducing our panelists and get the presentation started. Eileen?
Tonight, we are hosting a public forum on the impact of COVID-19 pandemic on Northern Lower Michigan. We are fortunate to have an expert panel with us tonight from our local community. They will discuss the effects of the pandemic on individuals and community, on the hospital, and on employment and childcare issues. The format for the presentation is as follows. Each panelist will discuss their topic area for approximately 15 minutes. Questions from the audience will then be addressed after all three presentations have been completed. Please feel free to submit any questions by clicking on the Q&A button during the presentations. Please note we have a limited time to answer questions and we'll do our best to answer as many as possible. First speaking tonight is Dr. Joshua Meyerson. Dr. Meyerson is the medical director for 3 local health departments in Northern Michigan: the Health Department of Northwest Michigan, Benzie-Leelanau, and District Health Department number 4. Dr. Meyerson earned his Doctor of Medicine and his Master's in Public Health from Tulane University in New Orleans. He completed his residency in pediatrics at the University of Mexico Children's Hospital and is a board-certified pediatrician. He is fellow of the American Academy of Pediatrics and a member of the Michigan Association of Public Health and Preventative Medicine Physicians. He also serves as a clinical assistant professor in the departments of family medicine and pediatrics at the Michigan State University College of Human Medicine and is a member of the Michigan Advisory Committee on Immunization. Next up will be Kathy St. Pierre. Kathy holds a Master of Science in Nursing and has been with McLaren in a variety of roles since the late 1980s. She is currently Director of Patient Care Services, and in this role, she works closely with the McLaren Infection Prevention Team. She also led the first COVID response team for the emergency departments at both the Petoskey and Sheboygan campuses and continues to participate in the daily activities that monitor and prepare the daily hospital response to the pandemic. Lastly, we will hear from Erica Van Dam. Erica Van Dam and her husband own and operate Van Dam Marine Company, Van Dam Custom Boats, and Boat Yard in Boyne City. Erica earned a biology degree from the University of Michigan and a master's degree in public health from the George Washington University. She has held positions in public health in Northern Michigan and currently serves on the board of directors of the Women's Resource Center of Northern Michigan, the Blue Plate Project, the Charlevoix County Community Foundation, and is a member of the steering committee of the Northern Michigan Community Health Innovation Region. Erica and her husband live in Boyne City with their 2 children. One attends Boyne City Elementary School and the other is age 2. Let's turn it over to our first panelist, Dr. Meyerson.
The Omicron surge, which is here, it's been confirmed in all 4 of our counties, and we already knew it was here just based on the rapid increase in the case rates. We're having more cases reported than we ever have. But to just give you an example of where we are, nationally, and these graphs came from the New York Times, but you can see, in New York City and Seattle, just these are areas that had an Omicron surge, really a few weeks before we did. You can see that rates went up in both vaccinated and not fully vaccinated individuals, but the really large difference between those. But you can see, like even in Seattle, really, a lot of vaccinated people getting sick with Omicron as well, and we're seeing that locally for sure. But when you look at the things that really are important that strain our healthcare system and our capacity, here's hospitalizations on the left, and you can see, in New York City, the difference between not fully vaccinated and vaccinated, as well as in Seattle, the same sort of statistics. And then looking at the weekly deaths that are being reported, and in the vaccinated group, it's really pretty much a flat line. We're not seeing increased numbers of deaths there. Deaths lag, but we are not seeing that except in the people who are not fully vaccinated. So the current surge and the current strain on our healthcare capacity is really a pandemic of the not fully vaccinated. So here's some snapshot. This is back in November, but the statistics aren't any different today. This is from the Michigan Hospital Association at the end of November, and 87% of patients in the ICU were unvaccinated. And then this is a little more local. Months in Healthcare puts this out every week. This is just from this week, January 11th. And you can see the people, a snapshot in time of the people hospitalized with COVID in their hospital system, and the vaccinated versus unvaccinated. And when you look at the people on the ventilators, these unfortunately, still, if you're sick enough to be on the ventilator, many of these don't make it. These turn in, over time, most of them unfortunately end up dying, and you can see, and this has been pretty consistent that vaccinated people aren't in this group. So that's really, good news if you're vaccinated, that your risk of death is much lower. And I think actually I didn't say that, but in these statistics, if you're vaccinated, your risk of death is 20 times lower. And I think with younger individuals, it's probably even more so than that. So 2022, here we are, and we're coming up, about to start our 3rd year of this pandemic. And really, I think this is a year that is going to be a transition. We're going to be moving towards a more endemic approach. We are not there yet. We are still in a pandemic. And I define that in the sense that our healthcare capacity is very strained. I'm sure you'll hear more about that. And our systems are strained, our schools are strained. So we are still in this kind of pandemic response mode, but we're also realizing that COVID is going to continue to be present. It's going to continue to mutate, and it's really going to just become one of the many circulating respiratory viruses that are out and about, and things, that we're going to learn to live with really every day. And so that's really going to be something we're all going to have to get to, where we're learning to live with COVID. At this point, investigating every case and contact tracing is really of little benefit. And it's also, with the number of cases we're having, it's just not feasible. So you're going to hear about that we're not going to be trying to investigate every case like we were. And really the focus is switching the NPIs, that stands for non-pharmaceutical interventions. And that's all the things we've been doing when we didn't have good treatments and we didn't have vaccines. That's the reduced gatherings and sheltering in place and wearing masks and isolation and quarantine. Those are things that are very important. But as we start having, other modalities to manage this epidemic, we can switch from that to the things we have. We have very safe and very effective vaccines. We have developed some very good treatments. They're much better at treating COVID, both with mild illness to prevent severe illness and to treat severe illness as well. And we've also we'll also continue to be doing things like managing outbreak control, outbreaks and things of that sort. So really, it's time to start this kind of transition, and that's where we are right now. And I think we're going to see that over the ensuing few months. And one of the things that just to update is this is pretty recent, and you've probably seen some of that, but even with that, the CDC's updated their isolation and quarantine guidance, and that's really, we're in this transition period. So now we're not trying to eliminate and really control things through contact tracing. So now for people who have COVID-19, the recommendation is really to stay home for 5 days. If you're feeling better, your symptoms are not necessarily gone, but improving, you haven't had fever for 24 hours, you can leave your house now after 5 days, not 10. And that's just, recognizing that, there's needs to keep society running, and this is going to be a lot more manageable for many people. You should still continue to wear a mask when you're outside. We should all be wearing a mask when we're out in public, but people in isolation should certainly continue to that. And if they're still sick, if they still have fever, well, then you need to stay home and stay away from people. And then for people who are exposed, the quarantine that was 10 days, for those people who are fully vaccinated, you've been boosted, and you are protected, you don't need to quarantine. But if you've been exposed, you should wear a mask when you're around people. And with Omicron having such a high breakthrough rate, we'd really recommend that you get tested on day 5 if possible. And the biggest thing is, if you have any symptoms at all, is to get tested and to stay home until you get that result of the test. Or really at this point of where we are, is if you have symptoms, kind of cold symptoms, you really need to stay and isolate yourself until you're feeling better and you've had that negative test. And then for people who need to quarantine because they are not maximally or fully vaccinated, they should quarantine for 5 days now as a recommendation, and then continue to wear a mask after that. For people who absolutely can't quarantine, the ask is to just really wear a mask for 10 days to try to get tested, and to really think about your movements and to be responsible to those around you, especially those who may be at higher risk of getting really sick from this. So I think with that, I'm going to stop talking, and I'm going to pass the baton off to Kathy St. Pierre from McLaren, Northern Michigan, who will give you her update.
Thanks, Dr. Meyerson. And thank you for having me today. I am also going to share my screen. I'm hoping you can see my PowerPoint now. So I just want to start by talking a little bit of the same thing that Dr. Meyerson talked about. We are seeing kind of those same numbers of the difference between a vaccinated and unvaccinated colleague or patient, patients. So from July to December of 2021, we've had 330 patients, COVID positive patients, be admitted to our facility. 228 of them were non-vaccinated, 93 of them were fully vaccinated, and 9 of them were partially vaccinated. And we consider fully vaccinated to be a two-shot series or one of the Johnson & Johnson and not being boosted at this point. And in that same time period, we had 48 deaths. 44 of those were non-vaccinated, and only 4 of them were fully vaccinated. So we're seeing kind of the same trends that the nation is seeing between the vaccinated and non-vaccinated colleagues.
Kathy,
Yeah.
This is Robin. Did you want us to be looking at a PowerPoint?
Oh, I did. Am I not showing
Okay.
it?
Nope, we're not seeing that. I just wanted to let you know.
Okay, let me see if I can get out of there and get back to it. Okay, sorry about that. Let's. Can we see it now?
Yes, we're all set. Thanks,
Perfect.
Catherine.
Sorry about that. So this is the graphic I was speaking about earlier. It really shows you, same way that Munson is demonstrating theirs, about our admissions. And those in the orangey brown color are the partially vaccinated people. The light blue is fully vaccinated and the dark blue is non-vaccinated. So here are the statistics from July of 2021 through December of 2021. We've had the 330 positive admissions, 228 of them were non-vaccinated, 93 fully vaccinated, and 9 partially vaccinated. 48 of those patients did pass away. 44 of them were non-vaccinated and 4 were vaccinated. So we're seeing the same trends that we're seeing across the nation and across the rest of the state as well. As we're caring for our COVID patients, we're really keeping our care patient focused. So each patient does get individualized care to some extent. We're following best practices for some of the care, but we are really focusing on the psychosocial needs of our patients. We know that we have to really limit visitors. We are connecting through iPads. We are letting occasionally a patient to have a visitor that we can get in full PPE to spend some time as well. One of the challenges for our patients is we've learned over time that the more time you spend lying on your stomach, or proning, we call it, the better your lungs are going to oxygenate. So a lot of our patients are spending anywhere from 16 to 18 hours a day, sometimes up to 20 hours a day, actually laying on their stomachs, which can be very uncomfortable and not make the time pass very quickly for our patients. As patients tend to get a little bit sicker, their oxygen needs increase and it makes them a little bit anxious. So that psychosocial needs and time spent with them does need to increase to kind of help keep them calm when they're having some air hunger. COVID does create a risk for blood clots. Those can be in your lungs, in your legs. We've had several patients who've actually had a heart attack due to blood clots based on the COVID diagnosis. So we're constantly assessing for those risks for our patients. We have made a focus of communicating ourselves with the family and supporting the family through this time as their loved one is admitted and receiving care with us. Not being able to be with them is a bit challenging. Our new ICU is on the ground floor, and we're seeing some very innovative families actually bringing papers and markers and communicating through some of those windows with their family members. They usually let nursing know when they're going to be there so we can adjust the blinds appropriately so that they can actually visualize and communicate through writing with some of their loved ones. We do have a lot of patients that move through different levels of care here at the organization. They may start in the med-surg arena or a lower level of care needs, and as their disease progresses, they might move to the cardiovascular unit and to the ICU. We did, at the beginning of COVID, had a separate respiratory isolation unit where we tried to cohort all the patients together, but found that was a very difficult unit to work in. So we've created a small respiratory isolation area in each of the levels of care that we have. And one of the most difficult is when you get to the point where you're going to have end-of-life discussions with the patient and or their family, depending on the current situation. We do allow pretty routinely for end-of-life discussions, at least 2 family members to be present, as long as they can tolerate wearing the masks and eye protection and a gown for that discussion, so that they can be there with their family member when we're having those difficult conversations. From a caregiver focus, it is really tiring to take care of a group of patients that are in respiratory isolation. You're spending a good portion of your day, in full PPE. It makes you hot. It makes you sweat. You can't have sips or drinks of water during that time because of the masking and eye goggles and face shields that are required. So we need to plan for different more breaks for nutrition, water, physical needs like the bathroom. They do make emotional connections with the families and the patients as well, which makes it hard because you get attached to your patients and they're here for a long time, anywhere from 25 to 41 days sometimes. So the nurses get connected both to the patients and to their families. We have had to be very, very creative in finding different ways to support our families in the care of their loved ones, connecting electronically, visually, and making some exceptions to our visitation policy. We have to support our colleagues, and we've actually had community members work with our foundation to actually support a psychologist being available for nursing and the direct care colleagues to be able to interact when they feel like they're overly stressed. But our team kind of supports each other as well. And now that we're seeing a little more Omicron in the area, we're having some staffing challenges because even with all the protection that we're taking, as well as our vaccination rates here at the organization, we're still experiencing some staffing challenges. Again, trying to get people back with the new CDC guidelines of 5 days, it can add one more layer of complexity, and some feel well enough to come back at that point in time, but others still need a couple more days off. Wanted to talk a little bit about the staffing challenges. You're hearing that across the nation, and we're experiencing that as well. So it's not all staffing challenges necessarily due to the number of patients that we have, but we do have symptomatic colleagues who need to be off. We have brought in travel nurses to assist us. And again, that's a highly increased cost of staffing right now. Some of the travel companies are charging up to $250 an hour for travel nurses. So that makes it a challenge to try to balance your finances with the care of the patients. We're seeing wages increase in the area around us. And I want to say McDonald's is averaging anywhere between $18 and $20 an hour in our local communities for new hires at their organization, but they have the opportunity to offset that by raising their prices, whereas prices are pretty fixed in the healthcare world. You get paid on a diagnosis and a DRG. You don't get to just say, well, we're going to charge $4,000 more for that open heart surgery, or so we still have that same fixed reimbursement rate that we're looking at. We do have colleagues seeking jobs in other industries from the stress of taking care of the COVID patients and the stress that the pandemic's put on hospital-based workers as well. And we do have some nurses who are seeing the opportunity to travel to make additional money and are leaving us here to take travel positions. I spoke with a colleague that worked here a few years ago who over the summer was able to, in 3 months, make about $130,000. And that allowed her, she's in a nurse practitioner program, advancing her education, but it allowed her to take the school year off of working totally and be a student and stay-at-home mom. So they're looking at those opportunities from a wide variety of reasons. The thing that challenges me and my team, I manage the house supervisors who really look at bringing in those patients in surrounding hospitals from us who need a higher level of care. We've had more declinations in the last 4 months from other hospitals for patients who needed to go to a higher level of care, but we haven't been able to take them. So on an average month, we bring pre-pandemic about 150 to 200 patients from the Midwest portion of the UP down to at least the Grayling area, sometimes even further south than that. For the last 4 months, we've declined more patients than we've been able to accept, to the point we're accepting about 1/3 of the requests and having to decline about 2/3 of the requests. So some of those patients aren't finding a location anywhere else in the state of Michigan. So they're having to be managed at the hospital that they were currently at. We're trying to take those that have the highest need, those that we feel like an intervention at a higher level of care would make a difference for. But just as an example, on a daily basis now, we get calls from eastern Wisconsin. We've gotten a couple calls from the state of Kansas. We've gotten calls from Ohio. We've gotten calls from the Thumb area in Michigan, all with nurses or transfer coordinators looking to find a place to send a patient when their organization can't meet the needs of the patient. We, instead of accepting patients routinely, we have a wait list. And some days that wait list has 15 to 19 patients on it. And we're constantly prioritizing which patients can we bring in that we can make a difference for based on the services that we offer that aren't offered where they're at. We're still taking every patient who's having a heart attack that needs to go to the cath lab. We're still prioritizing trauma high on the list. So if you are at an outlying organization or an outlying area and are in a critical car accident, snowmobile accident, any of our trauma situations, we're prioritizing those very high. We've learned over time that most hospitals can provide almost the same level of care that we can for the COVID patients. So we can't offer something different generally than they can offer, other than a few of the critical access hospitals who maybe only have one ventilator in their facility. So our inability to continue to admit in the patterns that we've done in the past is become quite difficult to manage, not only from the patient standpoint, but my house supervisors, transfer coordinators are feeling a lot of mental anguish about not being able to take those patients that we know in other times we'd be able to easily help. So when we're working with our COVID patients, testing is the first part of everything that we do. We're always looking at the patient's oxygenation, and we start with nasal cannula, which is the tubes in your nose with just a little bit of oxygen. We move quite rapidly with most of these COVID patients to something called heated high flow, which gives them a lot higher oxygen concentration. BiPAP is a form of ventilation where it's a positive pressure. So you start to take your own breath, and then the machine actually forces a little more air into with each breath that you do take. And then we do move on a significant number of patients to a ventilator. We've learned over time that we need to avoid the ventilator at all costs whenever possible. Weaning a COVID patient off the ventilator is extremely challenging. And for those patients that are requiring ventilation based on their COVID status alone, we do not have a very success rate of weaning off the ventilator. If you were to come in the hospital for something else, another injury, have a surgery, needed to be on a short-term ventilator, and tested positive for COVID but didn't have COVID symptoms, that's the only time I'm really seeing somebody effectively wean off the ventilator. So I just recently had a friend who was on the ventilator for over 45 days, and she didn't recover at all from that situation. So once you're on that ventilator for a long period of time, we don't have a lot of other additional options to offer. Lung transplants, sometimes there's a machine where you can oxygenate your blood outside of the body. We don't offer that up here, and there's only a couple places in Michigan that offer that, and getting a bed at those locations is extremely hard, very challenging. We do a lot of breathing treatments on our patients. We are using some significant medications, the remdesivir, monoclonal antibodies, steroids, convalescent plasma are in our pocket for care for most of these patients. We did talk a little bit about proning earlier, laying on your stomach as long as you can. Sometimes even when you feel like you can't anymore, it really helps with your oxygenation. We do provide IV fluids, supplemental nutrition and protein is important in the healing process. And we do have some patients who get some kidney impairment. And unlike regular dialysis, which can be very hard on your system, we have a system called continuous renal replacement therapy, where your blood is running through a machine very slowly 24 hours a day to clean the waste out of your blood. And we're finding that some of our sicker COVID patients need to be on CRRT. CRRT requires a one-to-one nurse in the ICU, which makes it a challenging situation from a staffing perspective when we're already stretched a little bit with staffing as well. But we do have the opportunity and ability to run 2 patients on CRRT. We have 2 pieces of that equipment available. So again, it is a resource that can be challenging at times. The monoclonal antibodies, that's one thing that we are finding, and we're running a large monoclonal antibody clinic out of our urgent care area. In order to be available to you, you can't be sick enough that you need to require hospital admission. So you need to come pretty early. You have to receive the IV infusion within 10 days of symptom onset, and you must have a documented COVID test. So we're looking for people with some pre-existing conditions. So age is one of them, your height to weight ratio, immune compromised, increased age, underlying respiratory compromise are all reasons that we would give you monoclonal antibodies if you tested positive for COVID. It takes about 2 hours from the time that we start interviewing you prior to your monoclonal antibodies, and then we monitor you for about an hour afterwards to make sure you're not getting a reaction. In October, I contracted COVID, and was not ill enough to need hospitalization, did get monoclonal antibodies on my 3rd day. And my personal experience is I felt like a human again in about 24 to 28 hours. It totally turned my illness around. Not everybody has that rapid of a positive response. Those that are vaccinated tend to respond better because you've already got some antibodies running around in your system that the monoclonal antibodies can support differently. But I'm hearing positive things from other patients as well, that anywhere from 24 to 48 hours, they're starting to feel much better instead of continuing to get sicker. So we are recommending that if anybody tests positive for monoclonal or for COVID, that they talk to their primary care provider about a referral to the monoclonal antibody clinic and looking to see whether they do meet one of the conditions where we would be able to treat you for that. There is a new monoclonal antibody. It is in fairly short supply that has a stronger possibility of working with the new variant that we're experiencing. But we don't have a lot of that on hand right now. So they're trying to get us more of that. We're using about, I want to say 80 to 95 doses a week, which is a pretty high rate for an organization our size.
Kathy, we have 2 minutes left for your presentation.
Okay, I'm just about done. Thanks.
Okay, great.
Yeah. So one of the things that we're looking at too is how do we educate people about what they can do to help the situation. So in order to keep increasing numbers out of the hospital, we'd like you to avoid large crowds, mask at indoor gatherings. If you're in a large crowd or indoor gathering, vaccinated or unvaccinated, we're still recommending masking. Know your own risk factors. So if you have underlying health conditions, you probably need to be more concerned about ensuring that you're masking and avoiding those large crowds. Vaccination, I think both Dr. Myerson data and our data have shown that vaccination and getting your booster are both going to help you stay healthy and stay out of the hospital. Monitor yourself for signs and symptoms. Stay home if you're not feeling well. We're hearing recently that people are getting a very slight scratchy throat as their first symptom. And some of them do continue to come to work because they're like, I don't know if that's enough to stay home or not. We're advocating that you do stay home if you're starting to not feel like your normal self, and continue to advocate with your friends and relatives about safe practices, just as you would be doing for yourself. And that's the end of what I have to share today. So I would like to take a second and turn it over to our next speaker, Erica.
Thank you.
Thanks.
Okay, so I am going to share my screen as well and get us started here. Okay, can you see my presentation? It has business leadership at the top.
Yes, we can.
Yes, you can.
Okay, thank you. Thank you. So as I was preparing for this presentation, I was working on my notes at home, and Ben said, what are you working on? And I said, well, I'm working on my presentation later this week. And they submitted some questions. So I'm looking through those questions. And he said, well, what's an example of a question? And I said, well, what has business ownership been like during this time? And he said, well, that's easy. I'll give you one word, crappy. He used a word that might be more offensive to some than crappy, but so that's kind of that. I hope I don't, probably everyone is dealing with this, and I don't know how unique of an experience I bring, but what I'm going to do is break down sort of the challenges that we have faced in 4 different buckets. I've themed them, so hopefully this all goes smooth. So I do want to emphasize, though, that you probably heard in my bio, I bring a different lens than most business owners. I do have previous education and a career in public health. And so what I'm going to share with you is our personal experience, but I'm also going to share some of the experiences that we've had throughout our business network. We're fortunate that we have a lot of partners in the community that we reach out to. And so I will share some of their experiences as well, which might be more reflective, not, having someone lead a business without that public health background. So the first bucket I'm calling COVID guidance and policies. And what I mean by this is this huge bucket of work around the COVID virus. So some of the questions that we get throughout the week for the past year and a half: what do I do if I'm experiencing symptoms? How do I get tested? When should I test? How do I buy a test? What do the tests mean? When will the results come? What does this mean for my family and friends? How do I count quarantine days? When can I come back? Will I get paid when I'm off? Should I come to work? How long do I have to be off? What if my test is still positive? My mom, my child, my spouse, fill in the blank, is experiencing XYZ. What should we do? Do I have to wear a mask? How long do we need to wear a mask? I feel uncomfortable with the person working next to me. Did you hear that so-and-so went to the bar, a party, an outing, etc.? These are the questions that we're getting every single day throughout the week. And as a business owner, I look to the CDC and the health department for my guidance and resource, but our team of 30 people on our campus looks to us. We really are the resource for them. We are the go-to. Ben and I have been that way. And we're the ones fielding the questions. And we want to be responsive to those questions. It's not enough to say, please look on the health department website. I'm doing that for them. We have to have the answers, and we might not have to have them that minute, but we do need to have them. I'm fortunate in this period of time that we only have 30 people on our campus. I can't imagine what business owners are facing that have more people. We really are doing a lot of mentoring, a lot of guiding, giving advice. We're doing research, trying to stay up on the changes. I'm working with people to figure out their contact tracing, what their quarantine guidelines are. Their own timelines. We're physically providing the at-home test at this point in time for every single employee that needs one. Some of them are requesting them for their family members if they're having trouble getting them. We're just buying them like anybody else. We don't have any special place to get them, but we are to the point where we're providing them for our team. So this bucket of work right now does feel never ending, but of course it ebbs and flows as the surges come and go. Just this week, we had 3 people on our campus test positive just with the surge in Omicron. And so I'm spending half a day to a full day of my time this week, just simply talking to them about their own case. I'm figuring out, when they can return to work, what are their symptoms? How are they feeling? Do they meet the definition of their symptoms are resolving? Do they have access to a test? I'm dropping them off at their houses. Not one of them has spoken to a healthcare provider. To Dr. Meyerson's point, we're not doing contact tracing with every single case. So all the counseling is coming from me. I'm mapping out their contacts. I'm getting vaccination statuses of their contacts, but then I'm doing that for my own team too. Who are they working by? Who are their contacts here on site? What are the vaccination statuses of all of my employees that they may have come into contact with? I'm thinking through our team of who needs to get tested and who doesn't and when. So this work can feel like a drain on a business, but I can say without a doubt that we're the exception to the rule. Most businesses are not doing this level of intense work with their teams. And in response, what they're experiencing is outbreaks in their workplaces. And then subsequently, outbreaks in the home. You know, you have a case in a workplace, it spreads like wildfire because a business isn't doing that intense legwork on site. And then it's going into the family's home and spreading to all of the family members in the home. So as a result, businesses are experiencing real staffing challenges. That people are off because they're positive with COVID. People are off because they're close contacts. People are off because their children are positive or their children are close contacts. So what we have done here and our approach here is to take a very intense hands-on approach, because we feel like COVID could be the wildfire that goes through our businesses and shut us down for 2 weeks. And we are accountable to our customers to provide, their product and to fill orders and to do good work, and to our employees to stay open. And so for a number of reasons, we don't want COVID going through the business. So we have taken that intense hands-on approach. The second major challenge is a webinar that could be 2 hours in and of itself, but I'm just gonna pare it down to our personal experience. I'm calling it the booming economy, wage inflation, and the Great Resignation, which Kathy already relayed to. So we truly are experiencing great economic times in this country. People have more disposable income than ever. Businesses generally are flourishing as far as demand for product goes. But we're also experiencing the Great Resignation. People are at a point in their life where they're looking for that next career that they're ready to move on to. And when all of these things are combining, what we're seeing is a great wage inflation. Of course, these are all indirect results of the COVID pandemic, but they are real and they are really hitting businesses. A normal wage increase might be an annual cost of living increase of 2 to 3% sometimes. What we're seeing, hearing, and personally experiencing is a wage increase 2, 3, 4 times a year in 2021, anywhere from 50 cents to $4 an hour. So this is significant. The work of employee retention and recruitment has become more important than ever for us. In fact, in our own business, we have shifted to 90% of our marketing and sales efforts just going to employee recruitment, not to selling more product. We have no problem selling right now. And this is on trend with every single business that we network with. The economy is very good for businesses. It's the need for employees that is really hurting. Human resources was once probably about 15% of my job. It's easily 50% of my job now. And that's what other businesses are experiencing as well. So the third main challenge, which is going to be a surprise to no one, is supply shortages and price increases. So if you've all heard, you're probably sick of hearing, is that businesses are experiencing supply and material shortages. This is being caused by a number of things, but we are seeing the effect of COVID on the workforce. We're seeing the demand for product increasing because of the economy, but we're also seeing businesses struggle with their employee workforce. And between these two things, we're in a very unique time. And we're a relatively small business, all things considered. We have 30 people on our team, and we bring in less than $6 million in revenue. I only share that because our list of vendors is going to be small compared to our large employers in the area. And we hear from vendors anywhere from 1 to 3 times every single week about price increases. And these price increases are anywhere from 2% up to 7%. And so, and the other thing that we're experiencing is that we have to have supply on hand. In our history, in our own business history, we've never been a just-in-time company. We've never had lean practices as it relates to just-in-time. And so what that means is we've generally had a good stock of supplies and materials on hand. It's sort of frowned upon by companies that practice lean, but it's served us well through this period of time. But in fact, every company that I know that has done lean practices, all of that just-in-time ordering has completely gone out the window. It doesn't exist anymore. You will not survive in an environment if you're only ordering materials when you need them. You must have a surplus on site right now. If you don't, your production will be halted at some point. There are a lot of examples that I could give of our business. A couple of them come to mind just because they were so significant. One of them is that we ordered a log, like a tree log, because we build wooden boats from Germany. And Germany has had much stricter COVID restrictions than we have had. And so they were shut down for quite a long time. Their mills were shut down. They couldn't have people working in the mills. And we were supposed to have that log in the States on dry land in July of 2021. And it literally just hit dry land yesterday in Seattle. And so there are two main reasons. One was because Germany was having such a hard time, and so the factories weren't open. But the second was that it was stuck on a container ship sitting in a bay on the West Coast. And so what this means for us, for our own customer, is that he was expecting to get his boat in 2023, and now he's not going to get his boat until 2024. When we order something that normally would have a lead time of 4 days, the lead time now is 4 weeks. And so what this all means is for us is that normally what would be some very straightforward decision-making processes suddenly become very complicated. So we're talking about, all these price increases that we're impacted by through our vendors. We're having regular conversations. We already have an existing pricing structure to pass on to our customers, but we need to be having real conversations about how these pricing increases are now going to change that pricing structure. Do we need to search for new vendors? Do we need to have a bigger list of vendors? How do we change our processes to better respond to shortages and delays? How do we build up resiliency so we can better react to these situations? So I had already prepared this presentation, and then today in the New York Times, I get an email breaking news. Consumer prices rose 7% in the year through December, the fastest rate since 1982. And you can see down there in the narrative, it's talking about, policymakers have hoped that supply chain problems might ease, allowing companies to catch up with the booming consumer demand. Instead, continued waves of virus have locked down factories, and shipping routes have struggled to work through extended backlogs as consumers continue to buy goods. So this is not an experience unique to us. Everybody is experiencing this. And the last main bucket I'm calling the politics of COVID. So unfortunately, COVID has become a political issue, and specifically masking and vaccines has topped the potential uncomfortable conversations that I might have with employees or customers. And let me tell you, our customers love talking about masking and vaccines and telling us their opinions on that. But on our campus, COVID has been a constant topic. As I said earlier with my previous career, it's very easy for me to address COVID topics. I feel comfortable with the conversation. I share the facts as they are.
Erica, we have 2 more minutes for you.
Okay.
Thank you.
I have had no issue sharing, encouraging vaccinations and masking. And currently with the surge, we have a masking mandate in place. That was a question that was asked of us. We've not lost any customers or employees over a masking mandate. But I do know companies that have lost on both ends. They've lost customers or employees because of a masking mandate or because they don't have a masking mandate. So I know the spectrum is very broad. I want to be, respectful of the time. I will jump ahead to just one thing as it relates to our customer service. One of the questions was, how has our customer service changed? And I'll just say that it has forced us to be very open with our customers about our philosophy on masking. And most of the time, our customers are really respectful. We always bring it back to 4 things. Number 1, we have a responsibility to take care of our employees. Number 2, we have a responsibility to take care of our employees' families as much as we can. Number 3, we have employees and family members on site that have health issues and would be vulnerable to a COVID infection. And number 4, we have a responsibility to the customer to fulfill their order. And so if we can't do that, if we're shut down or quarantined. I want to jump ahead. I'll jump ahead to the parent experience. And I'll just go over it very quickly. The first is masking. And this has become, a conversation. As you all know, I'm sure the struggles that the health department leadership faced with their school mask mandate. And I just want to say thank you to them for advocating for a school mask mandate. Those of us with children in the school system who were too young to be vaccinated at the time feel very grateful that there's a mask mandate. And, with quarantine guidelines, what parents are facing who have young children is basically children who are constantly quarantined and daycares that are constantly closed. It faces us like once a week. We have some sort of quarantine or closure. And I'm very grateful to the school for sharing the information that they have. They've been very open. They've been very forthcoming. They have kept us in the loop. And one of the things that has recently changed is if there's a school exposure in a masked classroom, an asymptomatic child doesn't have to be quarantined. And so that has been very helpful. But I will say that I think all of us are navigating sort of these social rules around COVID, sometimes business rules around COVID. And so learning and navigating the school rules around COVID has been challenging, just as things are changing in the world every single day and guidelines are changing every single day. So I would say the biggest struggle for us has been closures, daycare closures, and daycares and schools are not immune to the employee retention and recruitment problem and the struggles around that. So I've heard of closures for before and after school programs because of employee struggles, whether they're COVID related, like quarantine related on behalf of the staff, or just a shortage of employees. So it's been challenging having to respond to that. And I think the biggest question really is how do we balance all this? As Dr. Meyerson said, how do we learn to live with COVID? Because having children who are continuously quarantined or daycares that are continuously closed down is not sustainable for parents who are trying to balance work.
Okay, we have lots of questions and about 10 minutes per question. So we might have to send you some questions, Erica, to answer. But thank you so much to all of our panelists. This is such good information and really, really appropriate, and everyone is interested in it right now. So we're really, really thankful that we've had such a good panel on this evening. And we do have a number of questions coming in, some of which Dr. Meyerson has already answered in the Q&A. But we do have some questions. A couple were directed towards Kathy and what's going on at McLaren, Northern Michigan. One question is, what % of nursing and support staff are vaccinated, and how is McLaren handling this?
Yeah, so we do, CMS, who is our Medicare payer, has made it a mandatory situation to either be vaccinated or to have a documented exemption from vaccination. I just got a report today that McLaren Northern Michigan is currently at about 76% vaccinated, fully vaccinated. We have a few that are still partially vaccinated and finishing that. And then we have a percentage of those who've received either a health or a religious exemption. So from those three standpoints, we're hitting about the 92% at this point in time of either vaccinated or have an approved exemption.
And another question for you is there an average cost for taking care of a hospitalized COVID patient?
Oh, I really don't get much into the financial end of what the cost would be. I do know there are some government programs that support some of those costs, but depending on the acuity of the patient, if you're in ICU for a good portion of the day of your stay, your cost is going to be much higher than if you're on a shorter stay in a med-surg area. I do know from my particular point of view that there was no cost to me for the monoclonal antibodies as an outpatient infusion. My insurance covered a very small, narrow amount of that. We don't get charged for the medications, so we aren't able to bill for those. We're doing that more as a community service. We do get a very small fee for actually giving you the infusion. So, but the cost can vary widely depending on your needs.
And one question came up, and this is probably for all the panelists, what's your best guess as to what COVID will look like going forward? Will it continue to be as deadly? Will it burn out eventually? And will we need a vaccine for it every year?
I can try to answer that. I think what we're seeing is I don't think it's going to just go away. I do think it will become endemic over time, meaning it's going to be, one of many respiratory viruses that circulate. There'll be, perhaps seasonal patterns to it, but we will be. It's not going to completely go away. I think we're learning that your immunity wanes, whether it's from vaccination or natural infection, so that you can, and people are getting this more than once. What we'll need to do as far as future vaccine developments, whether it becomes, an annual vaccine or we need to change the constituents of the vaccine, those are things that we'll figure out over time. But at this point, we really don't know. To continue, I don't think you're going to continue to boost with the same vaccine that we have. I think there's diminishing returns there. And I'm not sure that I would expect to see that. But one thing we've learned is that this virus has been humbling to many of us for 2 years now. So I will not prognosticate.
This is Kathy. We're also planning on COVID being with us for the unforeseeable future. So we're changing some of the ways that we are doing things. We originally had a respiratory isolation unit with a lot of plastic and containing air. We're still taking a lot of precautions, but we're making it a little more of our normal daily practice. Because we know we're in this for the long haul. It's not a short-term situation.
Another question that came up is, we know that many people are testing positive at home, and Erica mentioned she's even supplying their staff with their home tests. These numbers are probably not going into our data. Is that correct?
Well, there is actually a link. If you go to the health department website, there is a link to self-report, and people can self-report if they have a at-home test. We ask them to actually take a picture of it and they can report it, and then we will put in the system and it will count. I think the other thing is, I talked about that I think we're in this transition where, truthfully, it's not as important to count all of the cases. We don't try to count all of the cases of flu every year. We have other ways, other means of surveillance where we can see when there is increased flu activity in a community. And those are the sorts of things you're going to see us transitioning to. It's really easy. I mean, we've all been kind of perseverating on what the cases are, and I still do that as much as anyone. And how many did we have? But and that's important, but more important is what's going on at the hospital there. What's their capacity? What's our ability to take care of not just COVID patients, but all of our patients? What's the capacity of our businesses to continue operating, and the health department and all of that? And those are going to be, again, how we learn to live with this.
And along those lines, what do we as a community, what do our community members, what can they do to help support the health of the community and, all of our healthcare workers?
I'm sure I will, Kathy already had a slide on this, but really, I think, patience is important for all of us. I think can be a virtue that would come in really handy right now. But also, number one, from a public health standpoint, is to get vaccinated, to get your booster if you haven't had your booster yet. And as Kathy said, if you are sick at all, even mild symptoms, a scratchy throat, it's best to stay home. If you're sick, to get tested. Even if that first test is negative, if you're not feeling well, don't assume it's just something else and go out, because that's when you're most contagious. And to wear a mask in public areas, because even if you feel well, you can, people are most contagious the day before they end up starting to get sick in those first few days of their illness. So all of us can be spreading this virus without even knowing it, and that's why it's important to wear masks in public.
And we had, oh, go ahead.
I do want to just add on to that, patience and be kind. Every business, whether it's healthcare, whether it's food service, whether they are experiencing staff shortages and they're doing the best they can with what they have, they are really working to meet the needs of their customer base. So patience and be kind.
That goes well with everyone. One of the topics that we didn't get to too much was and someone asked about tell us about the ongoing challenges for the long haulers, the COVID long haulers.
Yeah, I can speak to that a little bit. We do have several patients that had made it through their long-term hospital stay, but still have pretty major lung issues. So they're going through physical therapy, occupational therapy, looking to strengthen their damaged lung tissue again. We're still looking at studies, doing studies to determine at what point are we going to be able to say this is as good as it's going to get for you. We're also seeing some patients that have quite a memory fog as a long hauler as well. Spending all that time in the hospital, you kind of lose track of where you are, what's going on, and it takes a while and some perseverance to really get back to your normal memory state post-COVID, particularly if you've been in the hospital with us greater than 20 days. Still waiting to see a little bit more research come out on what's going to work to help those patients. I also support Gift of Life organ and tissue donation in our organization, and we're starting to see an increased need for donation after death of lungs for the COVID patients. And Gift of Life has changed a few of its practices now, because in the beginning of COVID, they said that if you had COVID, you can't ever be a tissue or organ donor. But now recognizing that there's a couple of organs that actually can work in from somebody who had COVID, not necessarily immediately prior to death, but a history of COVID ruled you out completely to be able to donate organs. So,
and regarding the pediatric population, how has all of this impacted them specifically, Dr. Meyerson?
Well, directly, fortunately, COVID tends to not cause severe illness in kids. That said, when you have lots and lots and lots of kids getting infected, some do have severe illness. So we have had, unfortunately, deaths in our pediatric population. And our pediatric children's hospitals across the state are very, very strained right now because of this current surge, because you just have so many children getting sick, so many people getting sick with COVID. So I don't want to downplay that. I think the other thing, and Erica talked about it as well, is our children are feeling the strains of what's going on in our society. And I think when you look at what's important to kids, and they need those social interactions, school is a center for a lot of that, from daycare and preschool and onwards up to school. So we have been very, very busy since the beginning of this pandemic, and our schools have as well, with really the focus on maintaining a safe environment in the schools, but just as importantly, maintaining in-person schooling. We know that for many kids, if they can't have that in-person school, they do not do as well, not just educationally, but physically and socially. They have a lot of behavioral health issues, problems with food security, and on and on. And in our rural areas, virtual school is challenging, and from an issues of equity, the children that most need in-person schools are ones where virtual schools would be most difficult. So our kids, I think we all need to have that responsibility to prioritize in-person education for our children, and to maintain whatever normalcy we can for our kids.
And when the pandemic first started, there was a lot of emphasis on the environmental surfaces and cleaning environmental surfaces. Is that still an effective strategy for reducing the transmission of COVID?
I think cleaning is helpful. but in a limited way. I think most transmission is direct, it's person-to-person contact. Good hand washing is always important, hygiene is good, and they are effective ways to reduce your risk of respiratory and gastrointestinal illnesses, not just COVID, but all sorts of other things that are going around. So I think it's good to do a general wiping down, especially of high touch surfaces. But, I think, in Lake Superior State, always issues a list of words to banish. I think deep cleaning should be banished from our lexicon of words, at least in the general public. Very different in a healthcare facility, but for general cleaning.
Okay, we have time for one more question. So I do have a couple of more. Let me see if we can find one that hasn't been answered yet. As far as availability of testing, not everyone has their employer providing the tests. How readily available are the tests? And can you get a test that also checks for influenza?
I'm sorry, I missed a little bit of that. I got distracted, but testing, we continue to try, the demand for testing is very high right now. And we continue to try to meet those needs through a variety of different things. I know, we're hearing more about trying to get rapid tests that people can use at home. There's definitely inequity in the availability of those at-home rapid tests, across the country and across different groups. And some businesses have like their own supplies that are almost, limitless, and other people, you can't get them at the store. And hopefully we'll hear more about that with some state projects to try to make those more available, because I think that is important. If we want people to be responsible, they have to be able to get a test.
And here at the hospital, for patients that we're considering admitting out of the emergency room, everybody gets at least a COVID test. If you're having significant respiratory symptoms, you do get that 4-panel test that looks for RSV, COVID, and influenza A and B. So we can differentiate what you have and how we need to separate you from the rest of the population.
Okay, thank you very much. This concludes our presentation and discussion this evening. We want to thank you again, all of our panelists. You've been very, very informative, and a lot of questions that people had, you've covered. We appreciate all the work that you've done, and boy, have you done a lot of work in this last 2 years. So we want to support you in your work any way that we can. Please note that our next public forum presentation is on Wednesday, February 9th. And it's organized by our Environment and Natural Resources Committee, when we'll have an expert panel present on the topic of local community pesticide use, problems and solutions. For more information, please visit our website, lwvnlm.org. Thank you very much.